one of the first things to know is that they're so new, there's so much we don't know, right? And so I think this is always true of science, that like an answer that you have today may not be the answer that you give tomorrow or the next day, because hopefully we're continually researching and continually learning. And that's kind of how we grow as scientists and as clinicians. But I think kind of at this point in time, I think one of the things that I really think is important is when you're meeting with a patient who might be considering a GLP-1, that you're thinking about truly informing them of what the medication does. So a lot of the ways that the medication works in our bodies are to kind of have an impact on hunger and fullness cues, have an impact on, how often you're driven to eat. And so changing some of these things about the way that our bodies react to and have a drive for food can trigger an eating disorder, or can exacerbate underlying disordered eating. And so I think for me, true of every patient that comes in your door, I think having an understanding of past history and current use of disordered eating behaviors is key before you're making any type of diet advice, weight loss advice, certainly, right? And I think that's even more true with GLP-1. So knowing whether your patient is at high risk and having that conversation with them is critical. And then I think, what I call kind of true informed consent, right? It's not just like, hey, do you want to take this medication or not? This is available or not. It's like, what does the medication do? How does it work? What are the risks? What are the benefits? And kind of what I talk a lot about expectation management. Like, what can you expect from being on this medication, and how does that fit with what you're looking for? And and what will and won't it change about your life and your body, right? So I think a lot about, eating disorders and disordered eating is a desire to change one's body. And some of that then leads into kind of, because you feel like this or that will happen when you experience those body changes. And so really trying to dive in to that, some of those expectations with your patients to make sure that the things they're thinking are going to happen are realistic for them, and likely to happen if they take on the medication, and that they have an understanding of that and the risks that come with it. So I think that, and kind of real careful monitoring and following up to be sure that somebody is tolerating it well, is critical as well. So I think, potentially helpful for some, certainly not appropriate for all, and need to be prescribed with a lot of caution and a lot of support.